While there isn't a single solution that can cure high blood pressure, you can try to control your blood pressure levels by taking small steps such as monitoring what you eat and drink. Dietary habits along with medical treatment play a major role in managing hypertension. Adding the drinks we will discuss in this video to your diet may help lower your blood pressure and prevent many complications that high blood pressure can cause. Welcome back. In this video, we will talk about 8 drinks that can help lower your blood pressure. The first drink that can help lower your blood pressure is beetroot juice. Beetroot juice contains nitrates, which are converted into nitric oxide. Nitric oxide plays a role in relaxing and dilating your blood vessels, which in turn lowers your blood pressure. Consider drinking 1 cup daily to benefit from its blood pressure lowering benefit. Beetroot juice evidence comes from this article, Dietary Nitrate from Beetroot Juice for Hypertension, a Systemic Review. The study shows that the drop can happen as soon as 30 minutes after drinking beetroot juice and lasts almost 24 hours. Beetroot juice can be made at home and stored in the refrigerator for up to 4 days, or you can buy supplements made of beetroot extract. The second juice is tomato juice. Tomato juice contains antioxidants like lycopene, which has been shown to have several different health benefits. Tomato juice evidence comes from this article, Scientific Evidence of the Beneficial Effects of Tomato Products on Cardiovascular Disease and Platelet Aggregation. The study found that tomato juice decreased blood pressure as well as LDL cholesterol, which is your bad cholesterol. You can have 1 or 2 glasses of tomato juice per day, but make sure to buy unsalted tomato juice to avoid unnecessary sodium, which can have the opposite effect on your blood pressure. Number 3 is hibiscus tea. Hibiscus tea contains antioxidant anthocyanin, which can help lower your blood pressure. Hibiscus tea evidence comes from these 4 articles that are listed on the slide. Research shows that 2 cups of hibiscus tea every day for at least 2 weeks can help decrease blood pressure, and it can take effect in 1.5 hours to 4 hours after drinking it, which might depend on the amount of anthocyanin in each cup. Like hibiscus tea, pomegranate juice also contains anthocyanin. Pomegranate evidence comes from these 3 articles listed on the slide. Also, pomegranate juice inhibits angiotensin converting enzyme, an enzyme that plays an important role in regulating blood pressure. One of the studies showed blood pressure reduction in men who drank about a quarter cup or more of pomegranate juice daily for 2 weeks. If you decide to add pomegranate juice to your diet, make sure it's 100% juice with no added sugar. The next drink is good for more than just urinary tract infection, and that is cranberry juice. Cranberry juice evidence comes from this article, Effects of Cranberry Juice Supplementation on Cardiovascular Disease Risk Factors in Adults with Elevated Blood Pressure, a randomized controlled trial. Cranberry juice is filled with anti-inflammatory and antioxidant properties that can help prevent spikes in blood pressure. Also, it may decrease blood pressure by dilating blood vessels and increasing blood flow. Be sure to get the unsweetened version of cranberry juice, as added sugar is not good for your heart. Number 6 is grapefruit juice. Grapefruit contains potassium, lycopene, and other natural plant nutrients that help lower blood pressure. Keep in mind that grapefruit juice has mostly been studied in combination with other juices that lower blood pressure. Its blood pressure lowering effect comes from this article. Grapefruit juice enhances the systolic blood pressure lowering effects of dietary nitrates containing beetroot juice. The problem with grapefruit is that it can interact in a bad way with certain blood pressure medications such as calcium channel blockers. It causes the body to absorb too much of the medication, which can cause your blood pressure to drop lower than it should. Number 7 is skim milk. Skim milk contains calcium, potassium, phosphorus, and magnesium, minerals that are known to help decrease blood pressure. Also, it is fortified with vitamin D, a vitamin that promotes healthy blood pressure. Skim milk evidence comes from this article, Blood pressure responses to high calcium skim milk and potassium enriched high calcium skim milk. The study shows that drinking 1 to 2 glasses of skim milk a day can help decrease blood pressure. The problem with whole milk or full fat milk is its saturated fat content. High saturated fat can increase the risk of developing high cholesterol levels, And high cholesterol levels in your blood can cause blockages in the arteries and interrupt blood flow, which can lead to an increase in your blood pressure due to high resistance in the blood vessels. The last drink may sound cliche, but water is one of the healthiest ways to manage your blood pressure. When you are dehydrated, blood vessels can constrict, causing your body to go into water-saving mode, which causes your body to reduce the amount of water lost through sweat, urination, and breathing, causing your heart to work harder and your blood pressure to go up. If you're taking blood pressure medications or any medication, it is a good idea to talk to your doctor or pharmacist before you change your diet. They can help you avoid any interruption or unwanted complication. Thank you for watching. Until next time, stay healthy and remember, health is the greatest wealth.